We're joined again by Cindi Gatton, private patient advocate. And you've heard her many times on Doc Talk. She's been calm, cool, and collected. But today she's a little upset, and we're going to find out why. Welcome to the show, Cindi.
Good morning, Dr. Gallups.
Glad to have you back. Well, what's got a bee in your bonnet?
Well, last week I puttered out to my mailbox. I brought in a letter addressed specifically to me, and I opened it up, and it was this very interesting, beautiful color advertisement that said, and I'll take a look at this here, "What have you done to avoid a heart attack or stroke?" Oh, well, this is kind of interesting. And then another little flyer that says, "Think an annual checkup is enough?" So the big flyer then announces that there is a partnership with a local healthcare system and a mobile testing unit offering ultrasound tests of the heart and arteries in my neighborhood. And these tests, and they list these 6 tests, typically are available for $2,100, but available through this mobile testing unit for the low, low price of $179. Call today and sign up.
Well, that sounds like a pretty good deal. So why does that anger you?
Well,
obviously, there's a little bit more.
There's a little bit more to this, because I think that many of us as patient consumers assume that screening tests don't have any risks. And the fact of the matter is that screening tests do have risks.
Yes, they do.
They have 2 risks. One is for the test itself, and the other is if the test shows what we call a false positive, a result that says, ooh, there's something wrong, but further investigation may show there really isn't.
That is true. You know, sometimes not knowing ignorance is bliss, right? But when you go out there and subscribe to something like this and just randomly have some testing done, because it comes from an institution here in Atlanta that is revered. You know, we have multiple hospital systems that fit that criteria. And now they're advocating for you to go get $2,000 worth of test for a low price. And on the surface, it seems like a good idea. But listen, I've seen this in patients as well. We perform a test, and they get the results somehow before I can tell them about it, and they will lose sleep over it because it's something abnormal, and they don't have the facts to go along with this. And that's why you need a qualified medical provider to go over these things with you instead of randomly going to get a test. So these tests performed, the concern that you have is what?
Well, I went and looked at one of these tests, did a little bit deeper dive. So the U.S. Preventive Services Task Force is a body that is impartial, that evaluates data and looks at what recommendations are for these tests. So I went and looked at all the 6 tests that were listed in this, and not one of them is recommended for the general population. And when I look through all the information that came in this flyer, there's a teeny tiny little asterisk for one of these tests that said it was only recommended if you were over 65 and if you had this, this, or this. But it didn't document that the rest of these tests are not recommended for the general population. So for grins, I decided to call the 800 number and just see how they would handle this. You know, my patient advocate detective hat got put on. And a very polite woman asked if we could go through some screening questions. And they did a very brief risk assessment. Do you have any risks? And I don't. I don't have any risk factors for stroke or whatever. But she went through them and then said, now you don't have any risk factors, but if you still want to have this test, we would be happy to schedule you when we're in your neighborhood on August the 28th. And I said, well, I'm kind of curious about that. So what happens if one of those test results is positive? And she said, well, we would give you those results and you could share those with your private doctor. But if you don't have a doctor from the health system who sent this out will be happy to follow up with you and coordinate any additional testing or referrals that you need.
And who said we're not in the age of healthcare consumerism, right? I mean, we are, no doubt. It's like trying to sell a car. At times. It's like selling anything else consumer-driven. Now we're seeing it in healthcare. And that's pretty disconcerting to me as a doc and certainly as a patient, because the trust level in the system gets undermined by something like this, no matter how well intended, because obviously this partnership, makes money. That's why they're doing it. And then this healthcare system is the recipient of patients. Once again, we're talking to Cindi Gatton, who is a private healthcare advocate. So, did you have any of the tests done?
No, I didn't.
I think that's a good move. That way you didn't get an abnormal result and lose sleep over it. And then, so what this is going to do is drive patient flow to this healthcare system.
Absolutely. And, I think the thing which was misleading to me, and the fact that it's not really transparent, is that follow-up for these 6 procedures is very expensive. If I go in and have a carotid artery ultrasound and something shows up on that, and by the way, for your listeners, we often think that ultrasound is like, this beautiful HD picture like you see on your flat screen TV. It's not.
That's right, it's not.
And the follow-up tests for that, when I looked at the U.S. Preventive Services Task Force list, the follow-up tests aren't unequivocal either. So ultimately, you may end up having to have a surgery to really know what was going on. And by the way, the risk for that surgery has a 3 to 5% chance of causing a stroke, the very thing that these screening tests were designed to prevent. And I think what really disturbs me is that going in as consumers, if we're going to go in and do this kind of testing, I really do understand the anxiety that we have of, gosh, I may be 50-something and I'd like some assurance that I don't have these risk factors. But we really need to be doing that in partnership with our healthcare provider, someone that we have a relationship with. And if we're going to go in and have these kinds of tests, we really need to understand what the risks are before we do them and what we're going to do if there's a positive result, because that takes you down a whole different road.
It really does. I tell you, you're hitting on something that I think is very important. Has been important for many years, but is even more important because of what's going on in healthcare today, because we're having to assume more responsibility. The cost of it is one small item compared to your overall health. So I think maybe the tradition is we know our bodies better than anyone. Maybe that's what we should be listening to. But we're going to see, I think, more and more of this type direct-to-consumer advertising, trying to drive patients to systems. And ultimately, for this healthcare system, it is about revenue generation. And I don't know, it's very, very bothersome. The doctor-patient relationship is now being shunned by this because you're circumventing that relationship and an educated medical provider to tell you whether you need these tests or not. We see there are companies out there, even down here in Buckhead, where you can go get any lab test you want. You just pay for it and get the result. Again, I'm a little better with that if it's just totally the consumer deciding they want to have that done, as opposed to being frightened into having some procedure performed. And honestly, I think it's really below this institution to do something along this line. But let's just call it what it is. I mean, it is trying to drive patients to their system because they need patients in their system. Right now is the cost of healthcare delivery in not knowing. So transparency here is very superficial because you're right. Any of these tests, though we haven't talked about every one of them, but they have something to do with stroke. And you might wind up having to go to 3 or 4 doctor's visits just to find out what the results are, not to mention, if you have something that needs further x-ray studies as well. So, and blood work, and now the time off of work and all of that. So that is a very good point. So what advice would you leave our listeners with regard to these patient drivers?
Well, as a savvy consumer, I would say that if your physician has ever recommended one of these tests for you, because you do have risk factors, this is a really cost-effective way to get that testing done.
Okay. Silver lining.
Yeah,
right?
Absolutely.
Right.
However, understand that you can't file it to your insurance. You're paying cash for it. And make sure you get those results to take back to your physician. Beyond that, there's a lot being written now about all screening procedures. And it kind of pays us as patients to if we're so inclined, to go to the U.S. Preventive Services Task Force website and look at the tests that are there. It's written in language that we as consumers can understand. And if you don't understand it, print off the guideline, take it to your physician.
Excellent.
Or consult with a private patient advocate to better understand so you can have that conversation with your doctor.
That's great advice. Great advice. Once again, Cindi, thank you for being here.
Always a pleasure.
You're listening to Doc Talk on Talk Radio 640 WGST.